Global stomach cancer death cases have alarmingly increased in the last 5 years. Very soon, nearly 1.8 million people will be diagnosed annually with this disease, and approximately 1.3 million will die from it. Just in East Asia, around 500,000 people die from stomach cancer every year, with Mongolia, Japan, South Korea, Tajikistan, and China being the countries with the highest incidence in the world. However, thanks to medicine and technology, Japan and Korea do not appear in the list of top 10 stomach cancer deaths per year. This means there are at least 3 main factors increasing your chance of dying from stomach cancer this year: your lifestyle, eating habits, and the technology available in your country. In this short documentary, I'm going to show you how to promptly detect stomach cancer. We will talk about its 5 silent symptoms that you surely don't know. And I'll give you a detailed guide on the type of diet you should follow to avoid dying from stomach cancer. Let's start by talking about the main factor that affects the likelihood of you developing stomach cancer at some point in your life: your stress levels. Chronic stress raises the level of a crucial hormone in our body known as cortisol. Cortisol is known as the stress hormone and suppresses our immune system. The immune system is our main natural ally to detect cancer cells and destroy them as they appear. Cortisol causes our lymphocytes to stop functioning properly. These are some of the main soldiers that our immune system counts on to fight against stomach cancer, because they recognize cancer cells and mark them so other immune system soldiers can destroy them. If our natural defense system against cancer doesn't work, then there's free rein for it to develop rapidly and grow without restrictions. That's why stress plays such a fundamental role in stomach cancer. Thanks to this 2009 study, we found out that stress is the main risk factor for developing stomach cancer. But the second is chronic gastritis. And this is where our little friend, Helicobacter pylori, comes into play. Helicobacter pylori is a bacteria that colonizes the stomach. This little bug causes chronic inflammation of the gastric mucosa, that is, chronic gastritis. Chronic gastritis leads to changes in stomach cells, causing them to mutate and proliferate, and over time, cancer develops. Moreover, Helicobacter pylori can inhibit the production of gastric acid, changing the stomach's environment and thus contributing to cancer progression. Now you know the main risk factors in healthy people who do not have cancer in any other part of their body. But what about your lifestyle and diet? This study found that people who sleep less than 6 hours or more than 9 hours a day, they have a 50% higher risk of stomach cancer than those who sleep between 7 and 8 hours a day. Additionally, people over 60 years old, men, active smokers, and those who are overweight and obese are at the highest risk of dying from stomach cancer. Regarding diet, the people most likely to die from stomach cancer are those who regularly consume salty and processed food, those whose diet is based on processed red meats, those who very rarely eat fruits and vegetables, and those who drink more than 3 glasses of alcohol a day. If you have any of the risk factors I've mentioned up to this point in the documentary, it's crucial to identify the 5 silent symptoms of stomach cancer that might be present without your notice. Number 1, weight loss. In medicine, we call it Non-specific weight loss, meaning if you lose between 5 and 10% of your body weight in just a couple of months. And if there were no significant changes in your lifestyle or diet, this is definitely a warning sign. In the case of a person weighing 70 kilograms, this represents a loss of 3.5 to 7 kilograms. Number 2, persistent abdominal pain. Stomach ache lasting weeks isn't normal. If it lasts a couple of weeks, it might mean a gastric ulcer, but these usually heal with the right treatment and diet. If you have a dry and constant pain in the pit of your stomach for more than 2 weeks, you should definitely consult with your gastroenterologist, as it might be stomach cancer. Number 3, early satiety. If you've been eating less lately because you're losing your appetite halfway through the plate, it's time to visit your gastroenterologist. It's not normal for our body to feel less hungry or get satisfied more quickly, suddenly, and without conscious restriction. If before you easily ate a whole plate of food and even wanted more, but now you feel full with just half, you should pay attention to what your stomach is telling you. Number 4, vomiting blood or black stools. Hematemesis is synonymous with vomiting blood, and melena is synonymous with poop with metabolized blood. If you have vomited blood or your stools are very dark, it's likely metabolized blood. It won't look red when you go to the bathroom. Instead, your poop will appear very dark. If this happens, it means that an organ in your upper digestive system is bleeding, and you should see a gastroenterologist. Number 5, but not least, pain when swallowing. There are stomach tumors that can be found near the pharynx. If it hurts when you eat, it might be a sign that the food is making contact with the tumor and the irritation in it causes you pain. Now, it's normal for a sore throat or the flu to give you pain that lasts a few days. But if you experience pain when swallowing for weeks, it's time to consult your doctor. The treatment of stomach cancer is the subject of another video, as surgery is required. But what we can do in this documentary is show you how to significantly reduce the risk of contracting it. The first thing you should do is find a way to deal with your stress. I suggest you see a psychologist, psychiatrist, meditate, do journaling, and read personal growth books. You might also need to change jobs. Discuss this with your therapist. You have to eliminate your main source of stress. It's that or your life. Second, you should avoid eating processed food. 0 snacks from now on. No munchies, no processed sausages and hams from the supermarket. Do not add salt to your food. Do not eat smoked food or grilled with wood. Increase your intake of vegetables and base your diet on white meats like chicken and fish. Thirdly, quit smoking and drinking alcohol. This one is self-explanatory. To understand why alcohol is so bad, I recommend watching my video on alcohol. Find it in the description or in the top right corner. Finally, sleep better. Sleeping too little causes cancer, and sleeping too much does too. Sleep precisely between 7 to 8 hours daily. I hope you found this short documentary useful. If you learned something new, please share it with someone it might help. Don't forget to visit my channel for kids, Tuvi Kids, right there. We educate this generation's children with values that will make them better people and give them tools to face the present. Here are 2 short documentaries you'll definitely find interesting. See you in the next one. Hugs.